A chat with Joan Kelley Walker and Angela Bonfanti. The CNIB Foundation, Fundación INCIA logo at the bottom.
Hi, everyone. I'm Joan Kelley Walker, and I'm really happy to be with you here today because I'm a volunteer, I'm a supporter of CNIB, and my mom also benefits from the great work that CNIB does. We have a really special guest today that I'm excited to talk with today, Angela Bonfanti, who's the Senior Vice President of Programs with the CNIB Foundation. Welcome, Angela.
Thank you, Joan. Thanks so much for having me. I really appreciate this opportunity to chat with you.
And thanks for all the great work that you've been doing. Now, we're all in this situation together. COVID-19 just seemed to spring itself upon us. And like everyone else, the CNIB has had to go virtual, and you've expanded your virtual programs all across the country. How did that happen? I know you had to work very quickly, but how is it going?
Well, thanks for asking. And I think before I answer the question, I just want to express my gratitude to you as an ambassador, you've been so amazing. And for everyone who's watching or listening, this woman is the real deal. And we could not do what we do without you. And so this is just yet another opportunity that you're offering your hand to help. But
thank you.
Really and truly, we're in this together. Clients, staff, donors, volunteers, we're all pulling together to do everything that we can to minimize the impact of COVID-19 to our community. So it was about the second week of March, where we realized we had an issue and we needed to respond. We had a choice to make. Our choice was to pare back and operate with a skeleton. We didn't know what was going to happen with funding, with revenues. Just like we're one of 90,000 registered Canadian charities, we were all having the same conversation, knowing that those dollars were going to fly out at some point. And we had to have a conversation with ourselves and so many of our staff and volunteers are clients. And I think that we came to the decision that no matter what happens, we are here to stay. We are relevant and people need us because our business model was based on getting people out of social isolation. So at a time we're being mandated to be isolated, how do we get ahead of those negative ramifications that we know to be very true for the blind and partially sighted community in Canada? Mm-hmm. So yeah, we ramped up, we turned everything into virtual programs, and we really did. This is a forever change for us. This is not going to go away, Joan, when COVID-19 is behind us, and I hope that day is much sooner than later. Yeah, and because we know that we needed to be reaching more people, and it was always on our agenda to create more virtual programs. But this, for all the wrong reasons, has forced us to make some pretty great decisions.
Mm-hmm. So there's a program called the Virtual Vision Mates program. What is that one all about?
So it's a spin on our Vision Mate program. The Vision Mate program has been one that's been around for a couple of decades at CNIB. The concept is matching a volunteer with a person with sight loss. Typically, a virtual Vision Mate will do things like come in and read mail for someone who can't read their mail, help them with their gardening, just have a chat, maybe help them with some cooking. But since we have to practice social distancing, what we found was there's an opportunity for volunteers to, for example, pick up groceries and drop them off at the door. I can tell you that an individual with sight loss today has so many more accessibility barriers in the grocery store than ever before. From the moment that they're waiting in line to people not being able to reach out a hand and help them if they're seeing they're going in the wrong way because they feel like they're violating physical distancing rules that we have. They show up to a bin that's empty with a piece of paper that they can't read, indicating where the stock might be or that they're out until X date. And then the delivery services are costly and some are backed up by weeks. So we have now volunteers that will say, we'll give the individual a call, we'll have a quick chat, and it's always nice to connect with someone. They'll give you a list of essential grocery items, perhaps some prescription medicine that they need as well. And off you go as a volunteer. You pick it up, you drop it off at the door, you stay 2 meters apart, you prearrange the payment. And it's a really meaningful way. I had a Vision Mate yesterday that I met with. He's a 70-year-old man in my neighborhood. His wife is severely cognitively disabled. He cannot leave the house, and he's her sole caregiver. And I needed to get him groceries. I mean, that's the reality we're dealing with right now. And we, and if you don't have a car or you can't get around, we have got the Virtual Vision Mate program allows you to pick up, the phone and call someone just to check in and see how they're doing. You know, they're living in isolation. They don't have people around them. It's good just to have a chat.
Mm-hmm. So really, it's all about connectivity. And I know that the CNIB and the foundation have really been spending a lot of energy doing check-in calls with participants from all across the country. That seems like a monumental task. How is that going?
Yes, you make
monumental
a very good
to
point.
say the least.
We had no idea what we were getting ourselves into, but we knew what we had to
Nobody does.
do. No, exactly. And I said to my team and I chatted and we said, you know what, we've got to call everybody. We need to know how they're doing. We need to know what's happening. That's how we got stories of the grocery store issues and other accessibility issues and issues of isolation. To date, we've made over 4,500 calls across Canada. It took us a couple of weeks because people are home and they have time to chat, and there's only so many of us. So we've got the next batch of 5,000 that we're deploying over the next couple of weeks, and then we're going to keep going. We're going to keep going until we, you know, way past COVID. I think we're getting a lot of information. We're reaching out. We're getting great feedback. We're introducing these individuals to our virtual programs. We've got over 150 new virtual programs that you can connect with via your computer or even through your landline if you don't have the internet connectivity. So you know, we're using it as an opportunity to say, hey, we're here. We'll help as best we can. There are things that can keep you busy. There are virtual programs that, you know, you can practice your knitting. You can learn technology. You can, you know, chat about whatever. We've got one for youth. We've got one for seniors. We've got them for working age adults who are looking to really protect their jobs at a time, you know, amping up their LinkedIn profile at a time where you know, businesses are down and you know, you want to stay relevant with your virtual type of skill set. So it's been amazing. Every day I'm talking to a dozen people or so, and everyone on my team is doing the same thing. And it's been just awesome to stay connected and say hello, and you just feel so great about the mission. You know, one call a day, and you think, wow, we're really making a difference, and that's really great.
So it occurred to me, so are all these phone calls that you're making people that have already identified themselves as, you know, wanting to work with the CNIB? What if there's somebody out there that's thinking like, okay, now it's over my threshold and now I just can't handle this, I need help. Can they call in? Like, can they reach out to you?
Absolutely. And so it's a really great point. And thank you for bringing that up. The databases of people that we know, as you say, we have permission to speak to. You know, we're not just going to the phone book and guessing who site loss and who needs a call. But we are promoting this as much as possible. So we're working with companies that have worked with us on our Come to Work program, for example, that have mass, you know, tens of thousands of staff, and we're asking them to push out an email to their networks, A, that we're looking for volunteers, and B, for clients, someone living with sight loss, now is the time to get in touch with us because we have things for you. So the promotion piece is just as important as the delivery of those calls. We know we've got 1.5 million Canadians that we know are living with significant sight loss. That's from our last StatScan survey results. And we don't have 1.5 million Canadians registered with CNIB. Not that they need to, but I feel like we've got more people we need to be talking to.
Yeah, now more than ever. So another program that I read about is called the Physical Distancing and Sighted Guide campaign. Why is that so important right now, and what's that all about?
It's one of those things that just it came up because of the situation today. We didn't plan for this. So we started receiving calls a couple of weeks into COVID and physical distancing about clients or individuals who are blind, either being let to, you know, run into a pole with someone close by that was afraid to touch them because of physical distancing. We have individuals who live by themselves, who don't have family that live with them, and who would typically call in a neighbor to help walk them to the grocery store or walk them to a medical appointment, that we're now not being availed that opportunity at all. So the campaign is really to talk to lawmakers, to talk to the media, and to say, yes, physical distancing is absolutely important. But there are certain individuals of the blind community who live alone and who don't have another way of getting out. They need someone's elbow to hold on to navigate safely to their doctor's appointment or to the pharmacy. So if you are in that position and you do need that type of support, then we obviously have some guidelines around, neither you nor the cited guide having been exposed to the virus, wearing your PPE, having your mask and your gloves on, and making sure this is for really some of the urgent tasks that people need to attend to. We've got, for example, individuals who are blind that are diabetics, and they need help managing their inaccessible insulin pumps. If they had a friend that lived on the third floor of their building, they used to come and change the pump for them. They can't do that anymore because everyone's screaming at folks saying, "Don't stay within, don't pass that 2-meter mark." So it is an exception. It is for urgent cases. It is primarily for health and primary basic care needs. But we do have some guidelines there because we don't want people being left in dangerous situations because no one feels they're allowed to help them.
Mm-hmm. Yeah, and it's really interesting that the way that the whole world, like something within people welled up, I think, out of people's goodness of their heart, saying like, how can I help? What can I do? So what is the best way right now for people to support the programs that we've been talking about and to support the CNIB during this time and beyond?
Well, the best place, honestly, is our website. So CNIB.ca in English, en français. We are here. We've got a great group of people that answer the phones. Whether you want to help, we could use it in any way possible. Whether it's to volunteer, whether it's to promote, whether it's to tell our story, whether it's to sign up to join our programs. It's CNIB.ca, or the toll-free number is 1-800-563-2642. We're here, 7 days a week. So we want to make sure we're helpful, and we want to make sure we could use the help from the promotional standpoint. I know lots of people are tapped right now from a philanthropic standpoint, but we need technology and people and infrastructure to keep these programs going so that we can continue to stay ahead of our mission and not let it get behind us. So we would appreciate the generosity of people, whether it's their time, whether it's their networks, whether it's their dollars. We could really use it all now more than ever.
Mm-hmm. And Angela, we appreciate the generosity of your heart and your time and your big efforts to really lead this charge. And, in closing, I know we're running out of time here, but I just want to say how wonderful it is to hear the plan that's been put in place and the way that it's being implemented in such a rapid and professional way. So thank you very much. And thank you everyone for joining us today.
My pleasure. Thank you, Joan.
Visit us online at cnib.ca. CNIB Foundation, Fondación y en logo at the bottom.